Hello, today is Tuesday, March 30th, 2021. This is Dr. Rhonda Johnson, and my message today is to hold on a little while longer. I watched the press briefing where Dr. Rochelle Walensky, who's the new head of the Centers for Disease Control and Prevention, pleaded for Americans to wear their mask and stick with COVID-19 prevention measures. She warned of impending doom as new infections rise once again in the United States. You know, we reached milestones again of almost 5,000 new hospital admissions daily for the past 7 days. And for the past 7 days, we've lost more than 1,000 lives to COVID-19. The CDC Director said frankly that she was scared, and she asked elected officials, faith leaders, and other influencers for help. She said, "I am calling on every single one of you to sound the alarm, to carry these messages into your communities." And she asked us just to hold on a little longer and get vaccinated as soon as we can. We are not powerless, she said, although we are all tired of this pandemic. And you know, I watch all the posts, I look at them, of all the celebrations, people going around maskless, celebrating at parties, in clubs, at restaurants. I understand we need to celebrate, but you know, let's be around to celebrate every single year, not just today. We can get out of this pandemic through vaccination and continued prevention. Did you know that 2 out of 3 new infections here in the United States for the coronavirus in March are in people who are under 65 years of age? The demographics of this is shifting, and young people are dying in the prime of their lives. So what are the coronavirus risk factors for young adults? Well, jobs are one reason why so many young people are vulnerable to coronavirus infection. They're working on the front lines and in their 20s and 30s in healthcare and food services and essential services. They rely on public transportation and ride shares. They often work in areas at high risk for exposure to the coronavirus. And then they frequent places for social gatherings, such as bars and restaurants and house parties and retail shops. And then there's our college students all across the country who are having to shelter in place because of peaks and of the coronavirus as these campuses have outbreaks. You know, a lot of young people with COVID-19 recover, but sadly, some do not. Our behaviors make an enormous difference in control and prevention of this virus. And if we can just continue to wear our mask, physical distance, practice good health, hand hygiene, and know the symptoms of coronavirus infection and get tested if we think we have it, and then quarantine to limit the spread of this disease, we could make a dent here. You know, if you've had COVID-19, you can get it again. It's not as common as, we don't hear about it as commonly, but it does happen. So folks, now is not the time to throw in the towel. Be encouraged, stay focused, even in the second year of this pandemic. Families, we have to keep talking to our young people, and all of us have to take action. It may seem sometimes like our messages fall on deaf ears, but we have to keep talking, keep encouraging, and in the meantime, we have to keep holding on because we can get to the other side of this pandemic. Now, I'm reminded of a spiritual song that we used to sing when I was a member of the Harvard Kuumba Singers. It was one of my favorite songs, and it went like this. Hold on, just a little while longer. Hold on, just a little while longer. Hold on, just a little while longer, because everything will be all right. Everything will be all right. That's my message today. I know that was a little surprise ending, but anyway, it's out there. You can clap your hands, you can laugh, you can sing along. And as always, because laughter, we need some laughter. It's a great form of medicine, and it makes our hearts merry. So have a blessed day, folks. Stay safe and continue to practice prevention. And get whatever COVID-19 vaccine you can get as soon as your time comes in the line.